Welcome to this video. Today I will be proposing a new method for the diagnosis of mental health disorders. This method is called the Symptom Discrimination Task or SDT. One method for diagnosing mental health disorders is listing symptoms, from something like the DSM or ICD, and asking patients if they have experienced them or not. But there is a possibility that if a patient believes they have an illness, they could be more prone to agreeing to having all symptoms, even if they don't. That's where the SDT comes in. Instead of just listing symptoms, the patient is presented with both real and fake symptoms. This aims to see if they can accurately recognize what they experience, rather than just agreeing with everything. Here's how it works. A psychologist reads out symptoms, some real, some made up. The patient responds with whether they believe they experience each one. The real symptoms are based on the DSM or ICD, while the false ones are carefully designed to be believable but incorrect. If someone consistently selects fake symptoms, it might indicate they are over-identifying with a disorder, rather than actually having it. This method doesn't replace existing diagnostic methods, it's just another option that could help psychologists differentiate between genuine cases and those influenced by expectation or misinformation. It does have many flaws, such as its reliance on introspection, meaning it still depends on the patient's self-awareness, but it adds an extra layer of filtering to reduce false positives. There are still parts to the method that have not been fully considered yet, like the best way to create realistic but false symptoms and how psychologists should be trained to use this method. Despite this, I believe that the use of the SDT in clinical practice could aid in the process of diagnosing mental disorders, which would greatly benefit clinical and health psychology as a whole.